So welcome to week 4, our second to last week. And tonight we're going to go over the BMET's role in patient safety and flow. Then we're going to talk a little bit about thermometers, warming and cooling units, and then we're going to go through the final project in case you guys have any questions that you'd like to have addressed in terms of the requirements for the assignment. Okay, so what is the biomed's role in patient safety? Does anybody want to jump in and give everyone an idea of what they think the biomed's role in patient safety is?
Probably to not cut corners and have integrity.
That's a big part of it. Yep. Anything else?
Communicate to the other staff that what it is that you're doing and what you need from them.
Yeah, that's a great answer. So really what our role in patient safety is, the things that both Bianca and Elias had just mentioned, but also we're responsible for as soon as that medical device comes through the door, we need to make sure that it's safe for patient care. So medical device manufacturers and system manufacturers as well really need to produce quality equipment. But between when it leaves their dock and when it comes to the hospital's door or the healthcare organization's front door, biomeds are the first ones that are going to touch it. So we're opening the box, making sure that it didn't get damaged during shipment. We're making sure that it's configured appropriately for patient use, making sure that, for example, if it's something that has alarms, that the alarms are configured in a way that it's safe for patients. We're the ones to do all of the incoming inspection checks to make sure that it's passing its functional checks, that, the how it was shipped didn't cause the chassis of the device to get shifted and, lead to the device not functioning as it should. So we really do a lot of things when the equipment comes to the door. We're doing electrical safety. Um, we're doing, electrical safety and maintenance of devices and servicing of devices all throughout a device or system's life cycle. And so we, are involved in a lot of that. So how does maintaining equipment relate to patient flow? Does anybody want to take a shot at that question?
I would say that if machines, like if the devices are good and running, then like patient flow, like it'll be good and running, basically.
Yeah. And then if you think about the opposite, when something's not working as it should, it may be depending on the size of the organization that you end up working for, it could be stopping patient flow altogether in that department. If you think about, a small rural hospital that may only have one CT machine or one MRI, if that unit is down and they can't actually image patients, it's going to stop patient flow. It affects, diagnosis that patients are getting. If they have an urgent need for imaging, in order to get the appropriate diagnosis that they need, like let's say a patient comes through the ED and they suspect that they suffered a stroke, they need to be able to diagnose that really quickly. So if something from an equipment perspective is down, that's relating to patient flow. Even if we think about larger organizations, where you may think, this there's 4 triage bays in your emergency department, for example, and one vital signs monitor that they're using to take blood pressure and SpO2 as well as temperature is down, and you have it in the shop because it's waiting for parts. That's affecting patient flow, even though they have 3 other triage bays. Um, because they have to, have the patients go through 3 rather than 4 bays. So instead of, at our hospital right now, we have like a 6-hour ED wait just because of the number of patients that are coming through the emergency department. It could increase the amount of flow going through that department. So making sure that, equipment is up and running is a big part of our job to make sure that patients are getting the care that they need. Can anybody explain why it might be important to keep communication open between you and other staff members? Yeah, that's a good point, Colin. If it's inaccurate, it may also require a revisit for the patient to get the accurate information. It's a great point.
For me, I think why it's important to keep the communication open is just so that like you're aware ahead of time of like what's going on and it helps you plan ahead.
Yep. So if we go back to that CT example, if it turns out that, we have to order a part for a CT scanner because it's down, and you tell them that the part is coming in on Monday, but it ends up coming in on Tuesday, they may have booked patients for Monday. And so not only are you disrupting flow because that open communication isn't happening, that, hey, the part's going to be delayed. Um, you want to make sure that open communication is happening so that, patients are able to get the the care that they need. So if we take a look at the biomed's role in terms of the equipment life cycle, is anybody familiar? Have they seen this diagram before? And then could anybody tell me, where they think that BMETs fit in terms of the different steps of the life cycle? Like where do we fit in best?
I would say all of it, but I mean inspections and maintenance, inventory.
Yep, you hit the nail on the head, Elias. So we're involved in all of it. So if we think about so this is the life cycle of equipment, meaning that any device or system that is in a healthcare organization really goes through all of this. And your department, um, different devices and systems are going to be in different places within this life cycle. So what I mean by that is, let's say that your healthcare organization has a large amount of infusion pumps that are becoming end of life by the medical device manufacturer. And it was decided from the hospital that they were going to replace them. So you'll be, in the department, be in that planning phase where you're trying to decide, okay, how are we going to start the process to try and figure out what we're going to replace our existing infusion pumps with in terms of a technology. Let's say that you're in the middle of your second year PM of your 2-year-old physiological monitors that are in your ICU. So those devices are in the kind of the inspection phase of this life cycle. And then they could also be part of this maintenance phase too. But the whole life cycle, whether it be, we're looking at new infusion pumps, we're planning the purchase of them, the education around them for our clinical staff and our technical staff. We are deciding when they're going to come into the hospital and that education is going to be performed for everybody, and when we're going to decommission the old infusion pumps. That's part of that whole planning process. Procurement means that you're actually purchasing those devices and bring them into the organization. And then as a biomed, you're going to get involved in inspecting those devices when they come through to the doc in the hospital or the healthcare organization that you work for. You're going to be involved in accepting those devices into your inventory. So CMMS refers to basically your equipment database. It's an acronym for computerized maintenance management system. Depending on your organization, there's a lot of different CMMS vendors out there. Our organization uses TMS. I've also used a CMMS database called HEMS. Nuvolo is a popular one that's out there that a lot of organizations use. Like I believe TriMedics uses Nuvolo. Some organizations may have their own homegrown internal CMMS that they use. So there's a lot of different databases that you'll put the information for your equipment into, and then also your service history. That's where it ends up getting stored. So over time, as I mentioned, those infusion pumps are going to need maintenance. So meaning after, and this is going to depend on the medical device manufacturer's recommendation for maintenance. It could also be based off of what your organization decides to do aside from manufacturer's recommendations, because in some instances, you can do what's called an alternative equipment maintenance plan, which means that you can do maintenance that's different from the medical device manufacturer. And so that you're going to end up doing maintenance over time on the different devices that you're going to see. So if it's like year one after the infusion pumps are purchased, you're going to be doing maintenance on those infusion pumps. You're going to be testing them, doing functional testing. Some infusion pumps you'll do electrical safety, not all. And you'll be rotating through and testing those over a time period. And then just like I had said, equipment goes through and eventually it gets to a point where it's too old and it can't be supported by the manufacturer. It can't be supported by a third party. So there has to be a decision to dispose of it and decommission it. And then the process starts back all over again. So, 7 to 10 years, maybe even longer, your organization, if you decided to purchase infusion pumps this year, may be looking to purchase new ones over the course of that time period. Any questions about our role in flow and safety before we shift gears into thermometers? All right. So next big topic, as I said, is thermometers. I have 3 major kinds here on the screen. They all have different methods to be able to measure temperature. Would anybody be able to tell me what this type and how this thermometer measures temperature here on the left-hand side?
Doesn't that one read across the forehead?
Yep. So it's called a temporal thermometer. It actually makes measurements from the temporal artery. So scanning it across the forehead, it's actually getting that reading from that temporal artery. What about this one here in the middle?
Wasn't that one for in the ear?
Yep. The official name, it's a tympanic thermometer. And then what about this one here on the right-hand side?
An oral thermometer?
Yep. So this one can actually be used for oral temperatures. It can also measure auxiliary, so under the armpit. And it can also do rectal temperatures as well. I did put a couple of probes here on the slide with some different color. These are probe covers, or not covers, excuse me, probe wells. So meaning that this probe here, when it attaches to this Welch Allen thermometer, it's color coded, and you can see on here, this one is blue. So that's this thermometer probe well here. Anybody want to take a guess why there's different colored probe wells?
They're different colors because like there's a different location where they get inserted into.
Yep. So that's exactly it. So the blue can be used for oral or auxiliary. Um, they specifically color code rectal thermometer probes, the probe well red, so that uh, you're not using the same probe, taking an oral temperature for a rectal temperature. Take it, there are covers that go over these probes that are because multiple patient use, and so the probe covers go over it. But they want to make sure that you're aware that this one specifically, this thermometer is being used for rectal temperatures because even though there's a probe cover, and they should be cleaning the thermometer after every use, the top of the probe here. There's always the possibility that they're not getting it exactly as clean as needed. So that's why there's the two different colors. So in terms of maintenance and what biomed is responsible for on these thermometers, it's actually pretty minimal. So for the temporal thermometer specifically, there's not really any maintenance that we do per se in terms of, proactively replacing things to prevent failure. What is usually recommended is so this head right here on the probe is a lens. And if the clinical staff are not using the cover to cover the lens, a lot of the times that lens will end up getting dirty and can cause low temperatures. So if you get a call that the clinician is saying, hey, my temporal scanner or temporal thermometer is reading really low temperatures, take a look at the cleanliness of that lens of this thermometer because that could be the issue. So doing, a little bit of cleaning of the head might be something you need to do to maintain it. The only other thing that we would do in biomed is the battery, which is a 9-volt battery, is behind a little door that is screwed on, or screwed shut, I should say. Some clinicians get really handy and decide to replace the battery themselves, and they keep a flathead screwdriver handy. But Biomed can go around and make replacements of those 9-volt batteries as well. There's no calibration of these devices specifically. Exergen's actually the pretty or is the main temporal scanner on the market. And so you'll see these primarily. There's no calibration of them. If they're off and you've done the cleaning, you've made battery replacements because the battery was low, but there's something else going on with it. Usually it's an exchange with Exergen for a full replacement, and they usually, if you have an agreement with them, they won't charge you for the replacement. Kind of the same thing for the tympanic thermometers. Um, some of the older tympanic thermometers that I've seen, they do have a calibration where they'll have like a well that you can calibrate the thermometer to specific temperatures. I think the newer ones tend to be very similar to the temporal scanner, where there's not really a lot we can do from a biomed perspective. We can, replace batteries in them, but in terms of, verifying the functionality of it and things such as that, there's not really a lot we can do. And then lastly, so these Welch Allyn SureTemp thermometers, these are probably going to be your most prolific thermometer that's going to be in your healthcare organizations, just because it has the capability of measuring temperature kind of in multiple locations on the patient's body. So that's typically where why they purchase these. And they're great for adult patients, pediatrics. So that's why, again, it's the most prolific. In terms of maintenance for these, it's really just a function check. So Welch Allyn has a calibration key that they provide to their customers. that you can actually, when you pop the probe well out of the back of the thermometer and unplug the key of the probe, you'll plug in the calibration key. And if you look at the little directions or the set of directions that are attached to the probe key, it'll tell you once you plug it in what temperature that the thermometer should read. And if it's outside of that tolerance that's listed on there, that's when you would actually work with Welch Allen to figure out what's going on, like what's wrong with it. Failures of these Welch Allen thermometers, usually going to end up having bad probes. The lot date on these probes, you can actually tell how old they are because it's a specific date. And the lot numbers, if you call Welch Allen and they're within 1 year, they'll actually send you a replacement for free based on the lot number, which is really nice. I like how they did that and with the manufacturing process. Um, when the probe fails, I believe it's an E05 failure or error code, and that those come up pretty frequently in terms of the calls that you'll get for these types of devices. The batteries are user replaceable. They're AA batteries. So there's not really too much aside from, just verifying the functionality of the thermometer to make sure that it's working as it should with that calibration key. Any questions about any of the information that we just talked about with the 3 types of thermometers? All right, so we're going to dive a little bit deeper into temperature and also, what the definition of a thermometer really is, and the different types of thermometers too. So in our field, and I feel like a lot of different scientific fields, we like definitions. So a thermometer, specifically a medical thermometer or a clinical thermometer, is a device used for measuring the body temperature of a human or other animal. So body temperature is a really important indicator of health and disease. It reflects the balance between heat production and heat loss in the body. So, somebody coming into the hospital has a really high fever, they may be dealing with an infection. It's a really good indicator of something going on in terms of that infectious process. Heat loss, somebody may be coming in from a very cold environment, maybe they're hypothermic. And so having a low temperature is indicative of something going wrong with the body as well. Normal body temperature, and this is going to vary a little bit depending on the source. Normal body temperature ranges from 97 degrees Fahrenheit to 99 degrees Fahrenheit, but it can fluctuate. So the time of day, the site of the measurement, the individual's age, activity, and health condition, those can all affect temperature. If you're depending on the site too, if you're taking, like, say, for example, an oral temperature and somebody has drank a very hot liquid or a very cold liquid, that could actually affect the measurement of temperature from that individual. Some different things physiologically that can cause temperature to fluctuate. So if we think of a patient who has sepsis, an infection, we talked about that a little bit already. Vitamin deficiencies that can actually lower your body temperature. Um, and cancer can actually affect body temperature as well. So there's a lot of different things in terms of, what temperature really tells us. So we talked about a lot of these types of thermometers already. We talked about oral thermometers and where their measurement is, rectal. We talked about where the rectal thermometers, it's actually through the rectum and through the anus, or through the anus and up through the rectum. Axillary is under the armpit. They use this a lot for patients that, can't put anything under their tongue. Um, and they're not easily able to turn patients over. So they'll take the measurement through an armpit. Pediatric patients, it's a really easy. If you have kids and you know this, it's easier to take a temperature underneath the armpit. And sometimes if they wiggle a lot, sometimes that rectal temperature is your gold standard. Tympanic, again, sometimes it's easier to take a temperature through the eardrum by, just putting it into the patient's ear. And then the temporal artery, which is the temporal scanner that we saw. So that's measuring temperature based off of the temperature off of the temporal artery across the forehead. And then in terms of just, you know, aside from the actual types of thermometer measurements, um, there's just an indication here of digital versus mercury versus infrared. So digital thermometers, those are going to be, like your Welch Allen thermometer, where it's using heat sensors to detect that temperature. Infrared is going to be like your tympanic or your temporal thermometer. And then mercury thermometers, which aren't used any longer in healthcare. And if you do see one, you want to indicate to that provider or that healthcare organization that they should no longer be having a mercury thermometer because if it breaks, if the glass breaks and the mercury comes out of that thermometer, it's considered a hazardous material. But the way that mercury thermometers work is the mercury expands when it heats up, and it moves along the scale to be able to determine what the temperature is. So we really talked a lot about uses of thermometers. So primarily they're going to be used to screen and do some initial diagnosis or like determine what a diagnosis might be. I know this says treatment here. Body temperature measurements are not really treating patients, but it's looking at the effect of a treatment. So if you think about somebody who has a virus and is given an antibiotic, once they're given that antibiotic, they're going to measure the patient's temperature to make sure that it comes down if they had a high fever. And so in that sense, it's going to monitor that patient's treatment over time. And then prevention, very similar. So it's things like heat stroke, dehydration, hypothermia, even a fever. If you know that a patient has a fever, um, there is the possibility of preventing further issues from happening with that patient. For example, leading to sepsis. So thermometers are used for so many different things that involve just the human body and how we treat patients as a whole. And then in terms of accuracy, so we talked a little bit about some of the factors. We talked about how, drinking a hot fluid or a cold fluid can actually affect the accuracy of the accuracy of a thermometer. The type and quality of the thermometer. So I know during COVID, a lot of people would use very inexpensive thermometers that may not be very accurate, or like how they were testing a patient's temperature may not have been super accurate because if you think about, and I know some places that weren't healthcare providers were doing temperatures like movie theaters would take the temperature of patients during COVID, and if your temperature was fine, then you could go in, but it's not to say that it was necessarily always accurate. Calibration and maintenance of the thermometer can affect the accuracy, although as we talked about, a lot of thermometers don't require calibration and maintenance any longer. There are some still out there, so it is something to be aware of. We talked about the user technique and experience, and then we talked about environmental conditions. And then the accuracy of medical thermometers can be affected by errors and variations. We talked about this already. So if, if the temporal thermometer is dirty, um, and they go and scan somebody, there's the possibility that it could be low. So that would be considered a systematic error. Random errors, so caused by unpredictable fluctuations or variations in the measurement, could be a human or environmental factor. So if we talk about that hot and cold drink again, could be considered a random error. And then lastly, the accuracy of medical thermometers can be improved by following the manufacturer's instructions and specifications and using the appropriate site and method of measurement. So if I'm looking for you know, a more accurate temperature, your gold standard is going to be your rectal temperature. It's getting closer to the core of your body. So if you think about that being your gold standard, there is going to be slight variations for your oral, your auxiliary temperature. Your oral temperature is going to be most likely 0.5 to 1 degree lower than your rectal temperature. The same thing with your auxiliary as well. So there's going to be slight variations because you're getting further away from the center of the body where that higher temperature is going to be. And then this is a chart showing, the difference, doing a comparison of all the different types of thermometer measurements that are out there and what the pros and cons are. So we talked about food and drink, affecting some of the ways that the oral thermometer works. If we think about rectal temperatures, it's the most accurate. Um, and the cons are that, it's uncomfortable, it's invasive, requires you to lubricate the probe before you put it in. And then, as I mentioned, if they're not cleaned very well, so meaning the reusable probe, there is the risk of infection. Um, and then this whole risk of breaking or swallowing mercury shouldn't exist any longer if we're not using mercury thermometers. Um, and then auxiliary, less accurate, gets affected by things like sweating and clothing. So, if you're trying to do an auxiliary temperature underneath somebody's armpit and it's not quite getting right into the middle of the armpit and the clothing is getting in the way, that can affect the um, can affect the temperature. But again, it's non-invasive and it's safe and it's easier to get an auxiliary temperature on a young child. So, and it's convenient too. You don't have to lube it like you would if you were doing a rectal temperature. Tympanic, again, fast and easy, non-invasive, unaffected by the things that the oral thermometer is affected by. But on the other hand, if there's a lot of earwax in the patient's ear, or if the patient has an ear infection, or the shape of their canal inside their ear isn't quite aligned with the eardrum, they may not get a good reading from that thermometer. And then lastly, same thing with the temporal artery or the temporal thermometer. It's fast, easy, and non-invasive. It's great if, there's people are drinking and eating food before they're getting their temperature taken, but so many things can affect it. Sweating, cosmetics can dirty the lens, as we talked about the lens being dirty, and then requiring correct positioning. And these actually can be more expensive, which is kind of interesting just because the technology that goes into it makes it more expensive than, say, these other alternatives. So lastly, and we talked about, normal body temperature being from 97 to 99. A fever, and again, these values are based on the source of information, so they may vary a little bit. So a fever is defined as a body temperature above 100.4. A low body temperature is defined as being below 95. And so, as we've already talked about, body temperature that's too high or too low can indicate a serious health problem, depending on, how high or how low that temperature is. I know when I've talked to my pediatrician about my daughter's temperature, um, when it starts to get above 101 to that, 102, 103, 104, they're really concerned about the temperature once it gets above 101 for the little kids, just because temperature in little kids can lead to things like seizures. So they want to make sure that if a patient has a temperature, that they're mitigating it with things like Tylenol or other ways, other medications, other ways to reduce temperature, so things like that don't happen. And the way that we can mitigate temperature is actually with these devices that we're going to talk about next. But before I go any further, any questions about thermometers and temperature as a whole?
No, ma'am.
All right. So when you have a fever or you are hypothermic because you were outside in the cold for a long period of time, what do you do about it? So warming and cooling devices are a great way to mitigate a cold or a hot patient. So there's two main ways that these devices function. One is through conduction, which is heat transfer via fluids. The other is through convection. And you may have heard of this term from like convection ovens. I know I have my oven downstairs is a convection oven, and that's heat transfer via air. So in terms of maintaining these devices, how they function. So if we talk about function first, the Blanketrol 3, which is a product made by Cincinnati Sub-Zero, which is on the screen here, the way that it transfers the heat or cooling is through blankets or things that wrap around the patient. So these devices will have water that circulates from their main chamber out through hoses and then to, cooling blanket or heating blanket or some type of wrap, depending on, what they need to heat or cool. And then in terms of maintenance of these devices, really centers around cleaning the water inside of them. So even though these are closed systems, over time, these devices can actually grow bacteria in them. And the FDA has been on top of this for quite some time in terms of medical device manufacturers finding a better way or a better solution to prevent these devices from growing bacteria. So the Blanketrol 3, um, in terms of how it gets cleaned. So one of the things, if you work on these devices, is you'll end up draining the water and running like a bleach type cycle through, or hydrogen peroxide, depending on what the manufacturer's recommendation is, through these systems, and then also check the pH once you've done your cleaning solution through it a number of times, and then run regular water through it as well. So your maintenance on these devices are going to be pretty frequent. The devices that we have at our one of our locations is actually every 14 days, and Biomed doesn't do the actual cleaning of these devices just because of the rigorous cleaning cycle that's required. We do everything but the actual disinfection of these units. But like the Cincinnati Sub-Zero devices, it might be every quarter, every 6 months. Really depends on what the manufacturer recommends. Some other things you might end up doing, like cleaning the condenser. You'll do function testing of the device. So you'll have some type of temperature measuring device. A lot of the Fluke multimeters come with like a thermistor probe that you can measure the temperature um, of the fluid just by wrapping it inside of the blanket, meaning the thermistor, and you can verify the temperature that way. You'll be measuring like under and over temp alarms on these devices. So with these devices, these conduction units, there's a lot of maintenance involved with them. On the other hand, the convection type devices, so this is called a bear hugger, and bear is spelled B-A-I-R rather than B-E-A-R. No idea why it's spelled that way. But so these devices don't really have a lot of maintenance to them. You may end up replacing some filters. Sometimes these keypads, because they get pressed so often, you end up having to replace those frequently. A lot of the times these, and this is the most, I'd say, prevalent device that you're going to see from a convection perspective. You'll see these bear huggers, and a lot of them have agreements where you're not really paying for any of the parts, and a lot of them are getting sent out for replacement of things. Aside from replacing, a couple filters and potentially the keypad, you're going to be doing function checks on them. You're going to be testing the over and under temp alarms to make sure those are working properly. But yeah, not a lot of maintenance with these. These devices you'll primarily see in your pre-op PACU space, even the OR. Those environments are so cold. These bear huggers are kept there to keep patients warm. And the reason why those environments are so cold is because they're trying to prevent infection from happening. So it's like the least possible or the highest possible temperature to be somewhat comfortable, but low enough to prevent infection from happening. These devices here are going to be more prevalent in, say, your ICUs, because you're going to have patients who, are being cared for longer that, say, are going through some type of viral process that they'll need cooling, or maybe they had a heart attack, and one of the indications for care for those patients is to keep their body temperature as low as possible. Um, and it allows the cardiac cells to just do better, to repair themselves, which is quite interesting if you ever look into research papers on that. Um, so these are the two types of devices. Um, any questions about conduction versus convection?
I have a question about the cooling device.
Sure.
So is the output sufficient enough for that, say, of a burn victim, or is that not its intended purpose?
I don't believe that's its intended purpose. Um, but let me get back to you on that because the manual should have a list of contraindications. The thing that I would be concerned about with a burn patient, for example, is because they're susceptible to infection. If any of this, the hoses or anything became loose and fluid, flowed onto that burn of that patient, that my concern would be infection immediately. So it may be contraindicated. However, I will get back to the class with that question.
Thank you.
You're welcome.
For
Any other questions?
From what I remember, because like here in Arizona, like we have a lot of like people suffering from like heat exhaustion and whatnot. Like
Yeah.
that's mainly what we use those for, is to like lower the patient's core body temperature.
Yeah. I've seen we have Arctic Sun devices too, which um the temperature is much more controlled incrementally for cardiac patients. So they tend to use them for that population versus say like one of these devices, which has a wider temperature variation in terms of what you can configure. So it's amazing that the types of things that they can use these devices for. It you wouldn't think it would be for as many things that they actually use them for. Any other questions? All right. So this is just a list of the various manufacturers that are out on the market for these types of devices. So we talked about like the Blanketrol device and what like the how it works and what the temperature ranges are. The bear huggers and what the temperatures are for those. I've honestly have never seen these devices before, these three that are listed here. I have seen the Meditherms out there a lot, in addition to the Blanketrols. In terms of the circulating water garment conduction device, one that's not listed here that we actually have, and I talked about the 14-day disinfection requirement, is the Stryker Ultrix. Um, and we were one of the first organizations to implement that device right as it was approved from the FDA. And we found a lot of issues in terms of how to maintain those devices in the sense that the design of those devices is horrible. So in order to drain the unit, there's a plug underneath the device, but the clearance from the bottom of the device where the plug was that held the water in and the floor was maybe a few inches. Their design thought process was all hospitals have floor drains that drain water into. Our hospital had one that you were able to roll the device to, so meaning there can't be a lip either. So if you think about showers, um, and being able to bring a device in there, it's so heavy that you wouldn't be able to lift it up and over the lip of a patient shower. But we've had one floor drain that was floor level, that was flush in order to drain the units. um, so they didn't really think very, I mean, I don't think that that's a common thing in a hospital. But they didn't really think about that when they designed the device, which was quite interesting, and we gave them some feedback on that. They did come out with a like a drain pan, but infection control was in our organization was concerned about exposure to water coming from those devices and being pooled into a drain, rather than directly draining into a floor drain. And so, yeah, kind of interesting when you start to see these devices, you not only um, realize, how much design engineers don't necessarily know what environment that these devices are going into. And some vendors are actually willing to take that feedback. We do a lot of feedback work with, say, like GE with a lot of our physiological monitoring devices. It just depends on the vendor. But um, that's the other type of device that isn't on here that I'm familiar with. Any questions about warming and cooling devices? I know that was kind of a very high level before we go into the final project again. All right. So, we'll go over the final project this week, and probably next week as well in terms of what the requirements are. So this is just more of a reminder, and then in case you guys have any questions, we can talk about what your questions might be. So as mentioned, you have to pick a piece of equipment that's not been covered in any of the materials of this class. As a reminder, during week 1, you guys went through the Medfusion 4000, but that doesn't mean you can't pick another infusion pump like the Baxter Spectrum pump. The equipment needs to have multiple steps in the preventive maintenance procedure. So a device like a thermometer that we went over tonight wouldn't be acceptable because there's really not a lot of maintenance that or preventive maintenance that we're doing as part of those devices. But you could do warming and cooling devices. So like the Blanketrol that we went through, that has multiple steps. Even the bear huggers, they have multiple steps in like their testing part of the procedure, so that would be okay too. If you're unsure of what you want to choose for the final project, feel free to reach out to me if you have an idea of what you think you might want to do. Even if you have no idea what you want to do, but you want some suggestions, even if you're thinking of just a category of device, like I said, reach out to me. I'm happy to provide any recommendations or let you know if the device that you chose is appropriate or not for the final project. In order to get a 60, which is the minimum passing grade for this assignment, these are the following things that you need to do. So you need to submit a service or operator's manual. It either needs to be a reference file attached with your final project, or it has to be a working link within your document. Or like if you choose a PowerPoint, it has to be on a working link in your PowerPoint. You want to include the entire PM procedure. You can copy and paste it into your final project, or you can include it as a reference file like you would the service or operator's manual. A list of test equipment and interface devices required to perform the PM. So again, test equipment, most devices are going to require some form of electrical safety. So you would include an electrical safety analyzer. And like if you do a defib, you want to do include a defib analyzer. We'll talk about defibs next week. And then interface devices. So an example of an interface device would be a calibrated, or sorry, a cylinder that would, I'm trying to think of the name and it's escaping me. The thing that when you are measuring fluid from an infusion pump, that like burette, that could be considered an interface device, or anything that attaches to the device that isn't necessarily test equipment, but it's used to actually do the PM, like the tubing as part of the infusion pump PM. And then I would submit the write-up as a PDF because formatting can get a little funky in Canvas. So make sure that you're putting it as a PDF. And then too, if I have a different version of Word or PowerPoint, it can mess with formatting as well. And then in order to earn 100 for the assignment, these are the additional things that you'd want to include. So what's the unit's primary function? So what does it do? What area or department would the device be located in or utilized? You'd want to name some manufacturers of similar units and their makes and models. So if you did an infusion pump and you did the Baxter pump, for example, the Baxter Spectrum pump, you could list the Medfusion 4000, which is made by Smiths Medical. You could list the Bebron Infusomat pump. Those are just some examples of pumps. Estimated list price cost of your unit. So if you're not able to find a list price, which is actually pretty common, not a lot of medical device manufacturers will put a list price on their website, you can reference a used cost. Just make sure that you're including it as part of your references at the end of your final project. So I know that you got a used price versus a brand new device price. Pricing of test equipment. BC Group is a great website in terms of test equipment pricing. Fluke and Pronk Technologies. Actually, no, Fluke definitely does not include pricing, but Pronk Technologies might. So I would use BC Group or Pronk Technologies for the pricing of your test equipment. Common failures, you'll find this in the manual. So if you have an error code, for example, that's a common failure, list what that error code is. And then anything you think is interesting or relevant about the equipment that you're doing your final project on. So tips for success, this basically says if it's not part of the guidelines that we just went through, on the two previous slides and you want to include it, include it. You're not going to get any points taken off. I like to learn new things. I always learn new things with these final projects from my students. So include it and, maybe I'll learn something new. If you do, for some reason, have a problem where you're not able to upload your final project or the files that are associated with it, don't panic. All I will say is don't wait until the last minute to submit your final project, because if you find that you are not able to upload it and it's 11:59 on the due date, I would try to get it done as early as you can, because if you need to send me an email, I don't want you to be in a situation where you're submitting it late, because late final projects, unfortunately, are not accepted. And that's because we have such a short timeline to get our final grades in. That's all the material for tonight. And we're right up against the hour. Any questions?
Could I speak with you after class?
Of course. If not, I hope everybody has a great rest of their week and a great night.